False information about the origins of COVID-19 is spreading faster than the virus itself, so much so the experts are coming out to tell the public not to fall for conspiracy theories. On February 18, 2017, international public health experts decried false claims that the new coronavirus was lab-manufactured. In a statement on the Lancet website, they said, "We stand together to strongly condemn conspiracy theories suggesting that the COVID-19 does not have a natural origin." The next day, the World Health Organization followed suit.
No evidence that this virus was produced in a laboratory, and certainly no evidence that it was produced as a biological weapon. They come from the animal kingdom.
So how did we get to this point? Here are 4 rumors fueling online misinformation about how COVID-19 came about. A group of scientists in India suggested in a non-peer-reviewed manuscript on bioRxiv on January 30th that the new virus was engineered from HIV, the virus that causes AIDS. They claimed they had identified very short insertions in the virus protein sequence that had an uncanny similarity to HIV. The backlash from the scientific community was swift. The paper was voluntarily withdrawn by its author 2 days later, but it wasn't fast enough to prevent some websites and social media accounts from circulating the erroneous findings. U.S. Republican Senator Tom Cotton has also floated the idea of the virus coming from a lab, but he stopped short from confirming it. In an interview on Fox News on...
Again, that's not saying that this was a bioweapon, but we do know they were investigating and researching coronaviruses in that laboratory. It could have been an accidental breach. It could have been a worker that was infected.
Cotton later tweeted to his more than 208,000 followers several possible theories about the origins of the virus, ranging from the engineered bioweapon hypothesis to natural causes. U.S. media were quickly to know that the senator was still repeating debunked myth, prompting Cotton to defend himself, saying he's simply keeping all options open. On January 26, the Washington Times ran an article that claimed the virus might have escaped from a laboratory in Wuhan, quoting a former Israeli military intelligence officer, but in the same piece, the same source clearly states there isn't evidence or indication for such incident. A woman named Huang Yanling was falsely accused for being patient zero of the new coronavirus. Claims allege that she works at Wuhan Institute of Virology, fitting into the online buzz surrounding this facility as the incubator of the COVID-19. The institute, however, denied in a statement on February 16th. Huang was a graduate student at the institute until 2015, when she left the province and had not returned since. Huang was in good health and had not been diagnosed with the disease. The situation on the ground is rapidly changing, and everyone is rightfully looking for reassurance. But there is a lot we don't know about COVID-19, and this uncertainty is creating a vacuum that conspiracy theories and online trolls are filling with bogus claims. As far as we know now, the COVID-19 virus was not man-made, but the same cannot be said of attempts to misrepresent the reality of the virus.